Hi, I'm Dr. Larry Malerba, and welcome back to the Materia Medica series here on the All Things Homeopathy channel. Up until now, I've covered a number of the larger polycrest remedies and nosodes, so I figured it was time to discuss some of the more common acute remedies, starting today with Bryonia alba. Now, to be clear, although Bryonia is probably the most commonly prescribed acute remedy in my practice, that doesn't mean that it's only indicated for acute conditions. It can definitely be helpful in chronic conditions too. In fact, the same is true of all remedies. Any remedy whatsoever can be useful in either acute or chronic situations. The fact is that we speak of different remedies as being acute or chronic or constitutional remedies as a matter of convenience. We do this simply because some remedies are much more commonly needed in acute conditions, while others have been repeatedly proven to be useful in chronic situations. And although these categories, acute, chronic, and constitutional, serve a useful purpose, it's important not to pigeonhole remedies. You don't want to think of a particular remedy as being only for acutes or only for chronic conditions. A good homeopath must be able to keep an open and flexible mind at all times, because you never know when arnica might be the simillimum for a chronic case, and you never know when sulfur could be the remedy for an acute ailment. Okay, so with that little word of caution, let's talk about Bryonia alba.
Bryonia alba is a remedy made from a perennial climbing vine called white bryony. It's also known as wild hops, and it's a member of the family Cucurbitaceae. Now, unlike some of the more constitutional and chronic case remedies, we're less likely to choose an acute remedy based upon its mental characteristics. Therefore, in describing Bryonia, I'm not going to begin like I usually do with the psychological profile of the remedy. Instead, I'll start by describing some of the key features of Bryonia. These key features are distinguishing symptoms or characteristic clues that help us to decide upon our choice of remedy. With this in mind, the key features of Bryonia are as follows: an aggravation from motion, general dryness, thirst for large quantities of cold drinks, sharp stitching pains, and mental irritability and an aversion to company. Now let's talk about these key features one at a time. Now, the first and most important key feature of Bryonia is an aggravation from motion. This modality by far is the one clue that will most often lead you to choose this remedy. Bryonia's symptoms are aggravated by motion. Not always, but sometimes, even the slightest motion will aggravate. This tends to be most obvious in the case of an acute injury, like a badly sprained ankle, for example. The pain is usually severe enough that it causes the person to not want to move the injured part. Situations like this are often best handled by bandaging up the affected part or putting it into a brace because it helps keep it immobilized. Given the severity and the acuteness of the pain, it also makes good sense to obtain a proper medical evaluation in order to rule out things like bone fractures, torn ligaments, and so on. Now, whether the pain is related to a headache, an arthritic joint, or a case of pneumonia, the same basic rule applies. If Bryonia is the indicated remedy, the person will not want to move because it will aggravate their condition. The person with the headache wants to lie still. The person with arthritis does not want to use the affected joints. And the person with pneumonia knows that motion will intensify his chest pain or trigger a round of coughing or both. As you can see by this last example, this modality isn't limited exclusively to pain. When we see symptoms like coughing, difficult breathing, urging to urinate, or even vertigo that are aggravated by motion, we naturally think of bryonia. Now, it's important to differentiate an aggravation from motion from other situations that can look similar to it. For example, when the person with a flu tells me that she's been lying on the couch all day and doesn't want to get up, I have to ask questions that will help clarify the matter. If she says she doesn't get up because she's too exhausted, I consider a remedy like gelsemium. If she doesn't get up because it makes her head hurt, or intensifies her muscle aches, or triggers her cough, then I think of bryonia. Now, another key feature that characterizes bryonia is dryness. We often see dryness of the mucous membranes of the respiratory tract, and this usually manifests as a dry, parched nose, lips, mouth, tongue, throat, and or larynx. There may also be dryness of the eyes. The bryonia cough is a notoriously dry, hacking, and non-productive cough. It's the opposite of a wet, mucousy, productive cough. As a function of this tendency toward dryness, we don't often see much in the way of discharges in a bryonia case. There can be dryness of the rectum with constipation and hard, dry stools, and there can be dryness of the skin. Some may even complain of a sensation of dryness, which can be either external or internal. For example, a person may say that a painful joint feels dry inside, as if it's lacking lubrication. Lastly, the bryonia fever tends to be dry with a noticeable lack of perspiration. So as you can see, dryness is a quality that runs all throughout bryonia symptomatology. All right, now the third key distinguishing feature of bryonia is its strong thirst for large quantities of cold drinks. Bryonia desires cold drinks at long intervals, which is to say that he has a strong thirst for a cold drink, but once he satisfies his thirst, he may not be thirsty again for a while. But sooner or later, the desire for another tall, cold drink will return again. And although this periodic thirst isn't always true, it is more indicative of bryonia than it is of phosphorus, which has great thirst for cold drinks more often. And while gulping down large quantities of cold drink sometimes brings relief to bryonia's dryness, that relief is usually only temporary. The next key feature involves the nature of Bryonia's pains. As previously noted, the dominant Bryonia pain modality is an aggravation from motion. However, the pain itself is typically described as sharp and or stitching. Now, there can be a difference between a sharp pain and a stitching pain. A stitching pain is like being stuck with a fine pointed object like a needle. Sharp pain is a broader category that can include the kind of pain produced by anything from a knife to a needle. In the old homeopathic books, the preferred term seems to be stitching. This choice of words may come down to cultural differences, because I know that most Americans use the term sharp and sometimes stabbing to describe such pains. They rarely use the term stitching. Europeans, on the other hand, seem to have a finer and more discriminating understanding of the language. If we look in Kent's repertory, it lists stitching pains in the chest, for example, but it does not list sharp pains in the chest. Interestingly, however, Kent does list stabbing pain in the chest, under which it says, see stitching. Kent also lists cutting pain in the chest, and not surprisingly, bryonia is found in a number of these rubrics. On the other hand, Robin Murphy's repertory, a modern American resource, lists sharp chest pain, but it does not list stitching chest pain. I guess the point I'm making here is that I believe that all of these terms can be used to describe Bryonia's pains, whether we call them sharp, stitching, cutting, stabbing, or even lancinating. Bryonia lists prominently under all of these types of pain. Okay, now the fifth key feature of Bryonia is its mental state. When sick or in pain, Bryonia is typically irritable and would rather not be disturbed. He wants quiet and does not want any activity going on around him. Don't bother him or talk to him, or else he may become angry. I like to think of this as an extension of Bryonia's aggravation from motion. He does not want to be moved physically, emotionally, or psychologically. He's averse to company and wants to be left alone in his stillness. And we tend to see this especially when he's suffering or in acute pain. Now, of course, there's a lot more to this remedy, but these are the 5 key features that characterize a Bryonia state. Once again, we tend to see an aggravation from motion, dryness, thirst for large quantities of cold drinks, stitching pains, and irritability and an aversion to company. Now let's stick with the same topic and finish the Bryonia mentals. Bryonia happens to be one of the most prominent remedies listed under fear of poverty. And this fear lies close to the core of his psychological makeup. Bryonia tends to be rather straightforward and emotionally uncomplicated. He is first and foremost business-minded. He is preoccupied with business and has little time for frivolity or nonsense. In this sense, we can say that Bryonia is basic, unrefined, and materialistic. He's determined and industrious, and he works hard to achieve financial security. He is busy, and he talks about business and worries about business. He may even dream about business, or about being busy, or about exerting himself. Bryonia becomes irritable and anxious about the future and about issues concerning material security. So we see how Bryonia's fear of poverty plays such a prominent role in his character and behavior. Now, we're not likely to see this aspect of the Bryonia psychological profile during most acutes. However, it is an important feature that can figure more prominently in chronic cases. So if we have an acute condition that looks like Bryonia, we shouldn't hesitate to prescribe simply because fear of poverty is absent. Another theme that figures prominently in the Bryonia psychological profile is home. Bryonia lists very strongly under the following rubrics: desires to go home, talks of home, homesickness, delirium wants to go home, and delusion that he is away from home. It's reasonable to conclude, therefore, that home is where Bryonia feels most safe and secure. In practical terms, we often see this desire to go home during acute illness. I've seen sick children who state repeatedly that they want to go home. I've had parents tell me that even though their sick child is already home, they nevertheless keep saying that they want to go home. Of course, we're most likely to see this altered state of consciousness during a feverish delirium, when the mind is confused and unclear. Okay, now let's talk about some additional Bryonia modalities. As we've already seen, aggravation from motion is the one modality that stands far above all others. In fact, without it, one hesitates to choose this remedy. However, there are a few more modalities that serve to emphasize and reinforce this desire to avoid motion, and they include an amelioration from rest, amelioration from quiet, better from steady pressure, better from holding the painful part, better lying on the painful part or the painful side, and better from bracing or splinting. When you think about it, all of these factors can be understood as attempts to minimize motion. If I apply pressure or hold on to my injured arm, it makes it less likely to move. If I lie on the side of my painful gallbladder, it makes it harder to move. When a person holds his painful chest while coughing, it hurts less. When a person with the flu holds his head while sneezing in order to minimize headache, we think of Bryonia. The bottom line is that all of these modalities are aimed at avoiding movement. Now, some additional Bryonia modalities include an aggravation from cold, dry weather or cold, windy weather, and worse from becoming chilled when overheated. Bryonia can also be ameliorated by cool, open air and ameliorated from perspiration. Some symptoms are made worse from being in a warm room. A couple more modalities include aggravation from anger, aggravation from mortification, and an aggravation of symptoms at 9 p.m. This last modality is especially important in terms of fever and chills. I've seen many cases where the fever or chills begin around 9 p.m. or recur at 9 p.m. Now, I'd like to mention a few Bryonia generals, starting with some food and drink preferences. As we've seen, there's often a strong desire for cold or ice-cold drinks, but there can also be a desire for warm drinks, especially warm milk. Sometimes there's either a desire for or an aggravation from meat, oysters, coffee, or wine. Lastly, there may be an aggravation from bread or an aggravation from gas-producing foods like cabbage or beans. Two additional generals worth noting are a tendency to develop right-sided symptoms, except in the case of headaches, which tend to be left-sided, and there's a tendency to sleep on the left side. Okay, now armed with these 5 key features and these modalities and generals, we can begin to sketch a picture of what a Bryonia case looks like. Let's use the flu as an example. Bryonia happens to be the #1 remedy for the flu. At least it has been in my practice. So when someone tells me that she developed chills around 9 p.m. and then began to have muscle aches and a headache, and that she's been laying on the couch all day because it hurts too much to move around, I think of Bryonia. When I ask about her thirst and state of mind, and she says that she's been quite thirsty for cold drinks and that she wants to be left alone, it confirms my suspicion. Now let's talk about the types of physical problems that Bryonia is known for. Bryonia has a strong affinity for conditions that affect the liver, the musculoskeletal system, and the serous and mucous membranes. Serous membranes are found around joints and around organs. These include the meninges of the brain, the pleura of the lungs, and the pericardium that surrounds the heart. These membranes may become inflamed and can be associated with swelling or an accumulation of fluid. The mucous membranes include areas around the eyes, nose, mouth, throat, rectum, and urinary tract. The mucous membranes can also become inflamed, and when Bryonia is the indicated remedy, they tend to be dry and lacking in moisture. Bryonia chest conditions include asthma, bronchitis, pleurisy, mastitis, and pneumonia. The Bryonia cough is often dry, hacking, and painful, and is made worse from motion. The person may hold the chest in order to minimize the motion produced by coughing. The cough can also be worse from eating, worse from breathing deep, and worse upon entering into a warm room. In case of pneumonia or pleurisy, we often see the keynote stitching pains, like needles in the lungs, which are aggravated by the slightest motion. Even the motion of breathing can intensify the pains. I once treated a nursing mother with an acute case of mastitis, which is an infection of the breast. Her symptoms began with fever at about 9 p.m. A large area of the breast became swollen, hard, hot, and painful. The clincher was that in order to cope with the pain, she had to sit as still as possible without moving. Bryonia brought about a rapid recovery. Abdominal conditions associated with bryonia include appendicitis, gastritis, hepatitis, vomiting, diarrhea, and constipation. A high percentage of appendicitis cases will respond to bryonia. The pain is worse from any motion, and the person wants to lie on the painful side, which is usually the right side. The bryonia constipation is characterized by hard, dry stools and dryness of the rectum. Cases of diarrhea are often worse upon first rising and moving about in the morning. In cases of arthritis or gout that need bryonia, the joint pain is worse from any motion, which in turn causes the person to become sedentary. Warm applications bring relief, and cold tends to aggravate. Cases of sciatica are worse from motion and better by lying on the affected leg. Naturally, we consider bryonia for any musculoskeletal injury that is so painful that the person does not want to move the affected part. Bryonia headaches are typically located in the left frontal region above the eye, with pain extending back to the occiput. The headache is worse from any motion, sometimes even motion of the eyes. Constipation may be a concomitant symptom that occurs along with the headaches. We think of bryonia in cases of vertigo that are worse first thing in the morning on rising from bed and or worse on rising from sitting. The person may complain of a sensation as if sinking down through the bed. In any of these conditions, we may also see additional keynote clues, such as the strong desire for cold drinks at intervals, dryness of the mouth or some other part, or an irritable state of mind with a desire to be left alone. Okay, now let's finish up with remedy relationships. Complements to bryonia include Rhus tox, which often follows bryonia well in acute injuries. Bryonia tends to fit the initial, most acute stage when an injury is most severe and the painful part is worse from being moved. Rhus tox tends to come into play later on when the pain is less intense and stiffness has settled in. Nat mur, sulfur, and alumina are chronic or constitutional remedies that commonly develop acute conditions that fit bryonia. Nat mur overlaps with bryonia in the sense that it too is reserved, averse to company, and likes to be left alone. And like bryonia, alumina struggles with constipation and often complains of a lot of dryness. All right, that's our first Materia Medica episode for an acute remedy. I'll be making an effort to cover more acute remedies in the coming months. I always welcome your comments and appreciate the likes and shares. Please don't forget to tell everyone about the All Things Homeopathy channel. And until next time, may the vital force be with you.